to 9 now, NHS hospitals will have to compete with each other and their private rivals under plans to use an expansion of patient choice. It's all designed to drive up standards. Wes Street in the Health Secretary is thought to be keen to overhaul the health service so that the money effectively follows the patient. Let's speak to David Hare, Chief Executive of the Independent Healthcare Providers Network. Morning, David.
Morning, Chloe.
So how would this work if I'm a patient and I need a procedure? I go to my doctor and they give me options of going either to an NHS hospital or a private facility?
I think what looks like being briefed out this morning is an expansion of those existing rights. It's actually been the case, I heard you say earlier on to your listeners that they may have heard this before. It's been the case for around about 15 years that you have a legal right to choose the best provider for you in certain circumstances. And that's usually for consultant-led care, things like hip operations, knee operations, cataracts, etc. And when you go to your GP, you're supposed to be offered a choice of multiple different providers. That could be NHS, that could be private sector, all paid at the same price. And you look at the wait time, the convenience for you, etc., and where you want to be treated. What appears to be being briefed out this morning is that the Secretary of State is keen to expand those rights into other areas where they don't exist at the moment. That could be services like audiology, some sort of diagnostic tests, podiatry, somewhat unclear really from the briefings, but I think a sort of desire to see what rights patients already have and which were reinforced early on this year by the Prime Minister and the Secretary of State in their elective reform plan to meet the 18-week planned care target again, to try and push those rights perhaps into some new and fresh areas.
So if patients have some degree of choice at the moment for certain procedures or operations, is it working?
I think the problem with patient choice policy is public awareness. So less than 1 in 4 of us recall actually being offered a choice of provider, despite the fact this has been a legal right in the NHS Constitution for 15 years. Does it work? It's very much a proven mechanism for getting NHS waiting lists down, even though it wasn't a legal right at the time. The last Labour government, who managed to get waiting times down to record low levels, used this very aggressively, along with sort of funding boosts and so on, to try and get waiting times down. So it very much sort of has worked. And when you look at the sort of benefits to patients, you can actually shave 3 months off a waiting time by travelling just 30 minutes. There's one region of the country where for orthopaedic weights, hip and knee replacements, for example, the average wait at the sort of worst third of providers is nearly 6 months. The best third, it's barely 2 months. So I think if it is made real, it can have real benefits to patients and really empower patients. The problem is we just have to do much more, and the NHS must have to do much more to make patients aware of that right.
And so is that a case of you go to your GP and maybe they're not telling you have that choice? And also, what are we finding out? So if I go to see the GP, is the GP saying it's just weights? It'll be a 3 month there, it'll be a 6 month there. Or is it also how specialised, one hospital specialises in this, so I would recommend going there? I mean, I'm just wondering if you could almost be bamboozled with too much information or not actually really given enough to make an informed choice.
It's a difficult balance, and inevitably it will vary between treatment types. So there are some specialised services, maybe there's a very small number of providers in the country that are able to safely deliver that treatment. And in that situation, I suspect that it's more likely to be a conversation with the GP that will refer into a particular provider. But there's an awful lot of patients for whom, you're talking about relatively routine procedures where lots of different providers already deliver that service, or actually, with those patient choice rights, a new provider might be coming into that particular system. We've seen that a lot recently with cataract treatment, for example, new cataract clinics coming into the NHS, and actually ophthalmology is now the only specialty where the average waiting time is less than it was before the pandemic because of increased choice for patients. So I think it sort of varies as perhaps why it isn't happening, but I think it is getting a balance. Patients do want a choice. We know that, well over 3/4 of patients say that they want a choice, but equally they want good care, they want quick and speedy access, and they don't want to be spending hours perusing lots and lots of documents in order to make that decision. So it will be a joint decision with the clinician, but also kind of looking at what information is available on about particular providers. One thing the Secretary of State has already said, he wants to make the NHS app the default booking setting. And whilst that's not possibly for everyone, for a large number of patients, that should make things a bit easier for them.
So do you think this could be one of the ways to bring waiting lists down?
Certainly, the evidence suggests that patient choice, money following the patient, encouraging a degree of contestability between different providers, a bit of competing for patients. I think we all know, don't we, if income is going to, another organisation, that very much focuses the mind on how efficient and productive and good quality that we can be here at this particular organisation. It won't work for all parts of healthcare. Certain parts of emergency care, for example, just don't work on that basis. But for things that, a wide range of potentially slightly more routine procedures, which is a lot of what patients need, this can kind of drive up standards and ultimately get waiting times down. And if it's to be extended into other areas, I think that's welcome.
Really good to speak to you. Thank you for explaining that to us. I'm grateful to you. That's David Hare, Chief Executive of the Independent Healthcare Providers Network.
It's fascinating. It's Annie Gray who's just written a book about it. So loads to get your teeth into. I do hope you will stay with us, Callum.
Absolutely. Gladly, Rod.
Gladly.
Thank you very much.
Thank you.
Good to speak to you just now, and we will catch you again at 10 o'clock. Rod Liddell standing by to look after the rest of your Saturday morning on Times Radio.
It's 20